Hello students, I am Dr. Komal Rathore, Assistant Professor KOMAL Prathya, Faculty of Ayurvedic Science in JAYOTI Vidhya PEET, Women's University, Jaipur, Rajasthan. So today's session we will discuss about vitamins and micronutrients disorders. First of all, importance of micronutrients. So micronutrients is very essential for growth, health, and development. And what is vitamin? Then vitamins are organic substances that are essential for several enzymatic functions in human metabolism. A compound is called vitamin when it cannot be synthesized in sufficient quality by an organism and must be obtained from the diet. Functions of micronutrients. So micronutrients is act as hormones like vitamin D, act as antioxidant like vitamin E, act as mediator of cell signaling and regulates of cell and tissue growth and differentiation. Example vitamin A, act as precursor for enzyme, cofactor biomolecules that help act as catalyst and substrate in metabolism. Vitamin A. So vitamin A is a generic term for many related compounds like retinol, alcohol, retinol aldehyde are often called performed vitamin A. Retinol can be converted by the body to retinoic acid, which is known to affect gene transcription. Body can convert B-carotene to retinol, thus called provitamin A. Functions of vitamin A. First is immunity, important for activation of T lymphocytes, maturations of WBC, and integrity of physiological barrier. Visual, integrity of eye and formation of rhodopsin necessary for dark adaptation, and regulations of gene expression vital to cell differentiation and physiological process. Fourth is growth and development, and fifth is red blood cells productions. Deficiency of vitamin A. Deficiency of vitamin A leads to ocular changes, extraocular changes. Now, ocular changes is night blindness and xerophthalmia. Extraocular changes is growth retardation, acquired immunodeficiency, and anemia. WHO classification of xerophthalmia. First primary sign and second sign is, first primary sign is conjunctival xerosis, xerosis A called conjunctival xerosis. Xerosis B, Bitot spot. Xerosis 2, corneal xerosis. And xerosis 3, corneal ulceration. Xerosis 3B, keratomalacia. Xerophthalmia N, night blindness. Xerophthalmia N, fundal changes. And xerophthalmia S is corneal scarring. Here xerophthalmia. Keratomalacia, corneal xerosis, and it is Bitot spot. Investigations, clinical evaluations as skin, eyes, and growth. Serum retinol is less than 20 microgram per dl. Molar ratio of retinol, RBP, retinol binding protein, is less than 0.7 is also diagnostic. Treatment of vitamin A deficiency. Timing or doses immediately on diagnosis. 50,000 units in children 0 to 5 months and children 6 to 12 months is 1 lakh unit. In children of over 12 months, male adolescent and male adult, 2 lakh unit. The following days, 50,000 unit, 1 lakh and 2 lakh unit. Subsequent content at least 2 weeks later is the same. Vitamin D. Vitamin D comprises a group of sterol, the most important of which are cholecalciferol vitamin D3 and ergosterol vitamin D2. Human and animal utilize only vitamin D3 and they can produce it inside their body from cholesterol. Cholesterol is converted to 7-dehydrocholesterol, 7-DC, which is precursor of vitamin D3. Function: calcium metabolism, cell differentiation, and immunity. So, calcium metabolism. Vitamin D enhances calcium absorption in the gut and renal tubules. Cell differentiations, particularly of collagen and skin epithelium. Immunity, important for cell-mediated immunity and coordinations of immune response. The deficiency of vitamin D. The deficiency of vitamin D leads to rickets in small children and osteomalacia. It's a very dangerous disease. And here is vitamin D deficiency causes and consequences. So here causes is sunscreen, melanin, latitude and winter. It does not absorb vitamin D. Medications and supplements, anti-seizure drugs, glucocorticoid, ampicillin, high-active antiretroviral treatment, or St. John wort. That's all are medicines. Hepatic failure, renal failure, nephrotic syndrome, obesity, malabsorption syndromes like Crohn's disease, Whipple disease, cystic fibrosis, colic disease, liver disease. They all causes vitamin D deficiency. Now, consequences is schizophrenia, depressions, infections catch the bodies, tuberculosis, influenza, upper respiratory tract infections, lung diseases, autoimmune diseases, cancers, several types of cancers, muscles weakness, muscles aching, osteoporosis, osteoarthritis, osteomalacia, and pseudofractures and rickets. Now, investigations. Radiological changes, loss of normal zone of provisional calcification, adjusting of metaphysis, winding of growth plate, swelling and coupling of metaphysis, generalized reduction in bone density, low circulating level of 25 OHD3, elevated serum alkaline phosphate, calcium level may be normal or low, phosphate level usually are unchanged or low. Now, toxicity, vitaminosis D. Infants, 2000 to 3000 international unit per day, adult 10,000 international unit for several months. Causes hypercalcemia, hyperphosphatemia, hypertension which manifests as nausea, vomiting, excessive thirst and polyuria, severe itching, joint and muscles pain, azotemia, nephrolithiasis, ectopic calcifications, disorientations and coma. Now, vitamin C. Vitamin C is called ascorbic acid. Humans are among the few species that cannot synthesize vitamin C and must obtain it from food. Manufacturers of collagens help support and protect blood vessels, bone, joints, organ and muscles. Protective barrier against infection and disease, promote healing of wounds, fractures and bruises. Deficiency of vitamin C. Deficiency of vitamin C causes scurvy. And so, signs and symptoms of scurvy. Blood vessels fragile, gums redness and bleed easily, teeth loose, joint pains, scorbutic rosary. Like costochondral junction is the more angular and has a shaped step off. dry scaly skin, lower wound healing, increased susceptibility to infection and defect in bone development in children. Legs assume a frog-like position. Hip and knees are rotated outwards. Now treatment. Treatment prevented by diet of vitamin C. Daily therapeutic dose of vitamin C is 100 to 200 mg or more. Please, students, these therapeutic doses have to be remembered because several examinations make any so many questions from them. Daily requirement is 45 to 60 mg per day in children. Thiamine, vitamin B1s. So different vitamins B, C, and vitamins B's several names have names that should be remembered. What it does in the body. Energy production and carbohydrate and fatty acid metabolism vital for normal development, growth, reproduction, health, skin and hair problems, blood production, and immune functions. Deficiency due to diet of polished rice. Beriberi, sign and symptoms. Develop within a 12-week. Dry beriberi and wet beriberi. So dry beriberi, peripheral neuropathy, difficult walking and paralysis of lungs. Reduce knee jerk and other tendon reflexes, foot and wrist drop. Progressive severe weakness and wasting of muscles. Now, wet beriberi, cardiopathy, edema of legs, faces, cardiac heart failure. This is food drops, beriberi and wet beriberi. Riboflavin deficiency. Deficiency is rare and often with other B vitamin deficiency. Several months for symptoms to occur. Burning of eyes, endless dermatitis, chillosis, swelling and shallow ulceration of lips, glossitis. Niacin, vitamin B3. Essential for healthy skin, tongue, digestive tract, tissue, and RBC formation. Processing of grains removes most of their niacin content, so flour is enriched with the vitamin. Deficiency of niacin, that's called PELLAGRA also. 3D. 3Ds, diarrhea, dermatitis, and dementia. It's a question of examinations. Deficiency of niacins. 3Ds, diarrhea, dermatitis, and dementia. Reddish skin rashes on the face, hand and feet which become rough and dark when exposed to sunlight. Pellagra dermatosis. Acute red swollen and itching, cracking, burning, and exudate. Chronic dry, rough, thickened, and scaly with brown pigmentation. And third is dementia, tremors, irritability, anxiety, confusion, and depression. And vitamin K. It is cofactor of the enzyme that catalyzes one step in the formation of prothrombin, needed for the generation to several clotting factors in the liver. Source green leafy vegetables. Deficiency coagulation deficit due to hypoprothrombinaemia and deficiency of factor 7 resulting in hemorrhages diseases of the newborn. 1 mg IM dose in newborn and that is in parenteral. And now is anemia. About anemia, I will discuss about in broadly, but in short form, because of micronutrient deficiency, I will describe there. Anemia. Iron deficiency is the most common cause of anemia and the most common preventable nutritional deficiency. The causes of iron deficiency: nutrition and blood losses. Nutrition's mother anemic, increase Fe demand, preterm IUG, cyanotic heart disease, prolonged breastfeeding, cow milk, malabsorption, and poor weaning. Blood losses in neonatal, feto-maternal transfusion, twins to twins transfusions, bleeding from umbilical cord, hemorrhagic disease of newborn. And our children, hookworm investigations, rectal polyps, and irritable bowel syndrome. And signs and symptoms of iron deficiency is tiredness, fatigue, headache, and breathlessness. Symptoms that is, and sign is pale conjunctiva, palm, tongue, lips, skin, spoon-shaped nails. Tachycardia, systolic murmur. If hemoglobin is less than 3, check for sign of CHF, chronic heart failure. Investigation, CBC first. Hemoglobin is less than 1 gram per dl. MBC, MCH, MCHC are or decrease. Reticulocytes count normal and minimal elevated. Peripheral blood smear, microcytic hypochromic anemia. Severe ferrous level decrease. PIBC increased. And serum ferritin level is decreased. So that's all our important investigation factor for anemia. Now anemia's treatment, dietary counseling, infant fortified milk formula less than 1 year of age. Dietary diversifications, food that are rich in iron include wheat fortified cereal, spinach, lentils, and beans. Iron supplements mild to moderate anemia 3 to 6 gram per kg per day of iron 3 to 5 months. And several anemia and cardiac compression started before infusion packaging of RBC 2 to 3 ml per kg. So that's all our treatment. Now zinc deficiency. Zinc is essential for the functions of many enzymes and metabolic processes. Zinc deficiency is common in developing countries with high mortality. Zinc commonly the most significant nutrients in complementary food mixture fed to infants during weaning. And zinc interventions are among those proposed to help reduce child death globally by 63%. And now zinc deficiency sign and symptoms. Skin lesions, immune impairment, diarrhea, poor growth. Diarrhea is very important. When diarrhea is occur, zinc deficiency occur. Dermatitis, enteropathica, AR disorders, defect in zinc absorption begins within 2 to 4 weeks of weaning. Periolar and perianal dermatitis, that is failure to thrive. About failure to thrive is the one session study, so I will discuss in another session failure to thrive. And zinc deficiency treatment, regular zinc supplement can greatly reduce common infant morbidity in developing countries. Adjust treatment of diarrhea, 10 mg per day for infant below 6 months and 20 mg per day of zinc in 10 to 14 days above 6 months infants. Zinc deficiency commonly coexists with other micronutrients deficiency including iron, making single supplement inappropriate. Empirical trial of zinc. Supplement 1 UG per kg per day is safe for infants. And that's all about this session. Thank you. I hope you liked the video.